Hello, this module will describe the role of a clinical presenter in the setting of telemedicine. The clinical presenter is critical to ensuring a successful visit between the provider and the patient. The responsibilities of the clinical presenter include setting up the room and equipment, explaining telemedicine to the patient, obtaining telemedicine consent, and performing physical exam maneuvers for the remote provider. Each of these roles of the clinical presenter is critical to ensuring a successful encounter. You are the hands-on touch of the provider. The first part is setting up the equipment and making sure that the room is effective for telemedicine. You may use different brands of telemedicine hardware and software in your practice, so the exact protocol of turning on the technology and opening the application is not detailed in this training module. The specific training for the telemedicine equipment you'll be using in the clinic can be found in links at the end of this module. Simply click the link for the name of the model that is currently in your clinic. However, there are certain practices for setting up the telemedicine room that apply to all telemedicine encounters. In general, make sure that the video camera is working and test all of the peripheral equipment is functioning properly. The peripheral equipment may include a secondary microscope camera, stethoscope, otoscope, and glucose monitor. In order for the video encounter to go smoothly, the lighting and positioning of the camera and microphone must be accounted for. The room should be well lit with interior lighting so that it is easy for the telemedicine physician to see the patient clearly. Daylight may interfere with the camera lighting, so make sure that drapes cover any windows in the room. The background of the room should be plain with no distractions, and you should be wearing muted colors. Before the patient arrives, ensure that the microphone is working. The microphone should be sensitive enough so that both you and the patient can be heard clearly while speaking at a normal volume. Thus, it is not necessary to speak louder than normal. The next part of this module discusses the steps to take once the patient has arrived. After introducing yourself and your role, the next thing you should do is explain to the patient how the telemedicine visit will work. It is critical that the patient knows what to expect during the visit so that they know what they are consenting to, as well as understand that they should be getting the same level of care and confidentiality as seeing a medical provider in person. Some key points to explain to the patient include: they will be seeing the provider on a screen and the provider can see them through the video camera. You, the clinical presenter, will be taking their vital signs and performing physical exam maneuvers for the distant provider, and the provider will be primarily responsible for taking the history. In addition, lab tests can still be run in the originating site, and the provider will be able to write prescriptions as usual. If there are any technical difficulties that prohibit completing the visit, you will attempt to troubleshoot, reconnect, reschedule, or have the patient see another provider on site. Once the patient is in the room with the telemedicine provider, introduce the patient as well as any family members who may be with the patient. The provider should introduce themselves, explain where they are located, and ensure that the patient has no questions about the telemedicine consultation process. It is important to keep the same level of professionalism as you would in a typical in-person encounter. After you take the patient's vital signs, the provider will direct the rest of the visit. Be sure to listen as the history is taken so that you can prepare to help with possible physical exam maneuvers and think of possible follow-up questions that the provider may have forgotten. A separate training module discusses the physical exam maneuvers you will need to perform in order to help the telemedicine provider. After the history is taken, the telemedicine provider will instruct which maneuvers he or she wants to be done in order to narrow the possible diagnosis.